Hello and welcome. If you're dealing with joint or tendon pain, especially in areas like the knee, the hip, the lumbar spine, or gluteal tendons, you're probably looking for the best treatments to improve your quality of life. Today, we'll take a look at 3 popular treatments: steroids, hyaluronic acid, and platelet-rich plasma, or PRP, and how they can help manage your pain. If you find this content helpful, please like and subscribe for more useful information about spine and joint pain. First, let's talk about steroids. Steroids are commonly used for inflammation and pain relief. They can provide good short-term pain relief, often reducing pain within days. However, this typically only lasts 1 to 3 months at best, sometimes not even that long. While they are effective at getting quick pain relief, they don't address the underlying cause of the pain and can have side effects with repeated use, like weakening of the tissues. Hyaluronic acid naturally occurs in our joints and helps to lubricate them. Hyaluronic acid injections can provide good relief, particularly for medium-term pain management. Studies have shown it to be helpful for managing knee osteoarthritis, with pain relief lasting longer than steroids, often up to several months, but these injections have to be repeated on average every 6 months. As we go through 5 recent studies, we will see a recurring theme. Steroids may be good for short-term relief, but rarely, if ever, provide long-term relief. The first study, published in Biomedicines by Swidowski et al. In 2022, found that PRP is more effective than steroids for treating both the pain and function associated with knee osteoarthritis over time. With WOMAC scores, you want the score to be lower, and although they were lower with steroids initially, after 1.5 months, that relief began to wear off. And at 6 months, the clear winner was PRP, with hyaluronic acid coming in a distant second. Diving in further, patients receiving PRP had better function at 6 months compared to both gel injections and steroid injections. This graph shows the trend of clinically meaningful improvements over time. And as you can see, you really don't want to be in that steroid group at 6 months. Things aren't looking good. The next one is a 2019 study by Fitzpatrick, published in the American Journal of Sports Medicine, looking at patients with gluteal tendinopathy, or pain in the hip and buttocks area. This study found that PRP was significantly more effective than steroid in providing long-lasting pain relief. And even after 2 years, patients who received PRP reported less pain and improved mobility compared to those who had steroid injections. Looking at these graphs, it's easy to see how steroids start wearing off at 6 months, while leukocyte-rich PRP is still going strong. And looking all the way out to 2 years, pain and function is significantly better in the PRP group compared to the steroid group. Now, we've known for a long time that steroids are not good for tendon health, which is another added benefit to choosing PRP for this difficult condition. Moving on to the hip joint itself. In 2023, Sambi et al. Published an article in the journal Curious, which also compared hyaluronic acid with PRP for hip arthritis, showing that while hyaluronic acid provides decent pain relief, at 6 months PRP is more effective than gel, in addition to improvements in pain and function. A study in 2021 by Krautler in the Orthopedic Journal of Sports Medicine looked at this very subject and found that for hip arthritis, patients receiving PRP instead of hyaluronic acid were twice as likely to avoid hip replacement surgery at 2 years following a single injection. That's pretty cool if you ask me. Lastly, PRP has also been found to be very effective in treating low back pain caused by facet joint issues. The facet joints are like the knuckle joints of your spine, and just last year, Cauchon et al. Published a study in Interventional Pain Medicine demonstrating that PRP injections helped patients with chronic back pain, reducing symptoms significantly and improving mobility over a 6-month period. These graphs make it pretty easy to see how quickly the effects of steroids wear off after an injection. And while it's nice to have the significant relief offered by steroids in the short term, the idea of getting steroid injections every 2 months is just not a very good long-term plan. And it's definitely not a nice thing to do to your poor old spine. So, we have seen in all of these studies, across a wide variety of spine and joint problems, PRP comes out as the clear winner in terms of long-term improvements in both pain and function. Instead of using harsh chemicals like steroids, PRP works by using a concentrated and specialized preparation of your own blood. Platelets in your blood are full of natural growth factors that promote healing and tissue regeneration, helping to repair damage and reduce inflammation, not just providing short-term band-aids for your pain. To summarize, steroids provide short-term relief but don't offer lasting benefits. Hyaluronic acid can help for a few months, but PRP stands out as the treatment offering the best long-term results and potentially delaying the need for surgery. If you're dealing with knee pain, hip pain, or back pain, PRP could be the solution to help you manage your symptoms and improve your quality of life. Remember, always consult with your healthcare provider to discuss the best options for your specific condition. Thanks for watching, and please take care of your joints and tendons, and have a great day.